Dr. Bonine, whenever you're ready.
Yeah, well, thanks for having me. So in the last month, we've seen a massive increase in overdoses. I think every shift I've worked, either I or one of my partners have taken care of people that have been overdosing. Apparently, in the community, there's some cocaine that appears to be laced with fentanyl. And the problem is the fentanyl's very potent. And I think a lot of young people are getting into drugs that they don't recognize or realize they're taking. And unfortunately, it's so potent that it's resulting in overdose. So a lot of kids are coming in, mostly young people, very, very sick. Fortunately, LPD and LFR have been carrying fentanyl, which is massively decreased mortality. I think a lot of more people would be dead right now if they wouldn't have been given the fentanyl in the community. But yeah, it's been a real big issue, and it's been pretty tragic because all the stuff's very preventable. So.
Okay, thank you, Dr. Bonine. I would like to let the media know that our team has kind of went back and we can tell you that since July 12th, we've treated 18 patients with overdose related issues. So you can use that for your stories as well. Dr. Myers, go ahead, feel free to address the media and just kind of discuss some of the resources that we have available to overdose patients and their families as well.
Yeah, absolutely. And I would like to start with some statistics. I always like to kind of look back and kind of look at, you mentioned the 18 that we've seen in our emergency room. And if you look just back at Nebraska and the nation, in 2020, Nebraska saw our overdose deaths jumped nearly 43%. With over 200 individuals dying in 2020 alone. But if you look at the United States as a whole, in 2020, we saw that increase 29%, almost 93,000 deaths. So, if you look back over the last 20 years, the Center for Disease Control is where I'm getting all this information. You just see the line graph just going straight up, just an upward trajectory. But over the last 2 to 3 years, that that line is a sharp increase up, and there's a lot of reasons for that. A lot of different theories, but it's always looking at the social and economic impact that individuals, social and economic stress that individuals are going through. But a lot of theory with the current pandemic. That has added the extra stress that individuals are under. And what we found, or what we're seeing, and we're seeing a lot of different research that's out there, is and there's no, we're not pointing any fingers at anybody, because everybody was doing the right thing in terms of creating a safe environment. But individuals who are using substances and who are wanting help, they need connection, they need connectedness. And so individuals, need support groups, they need treatment, they need services. And during the pandemic, what we found is that, a lot of services had to reduce capacity, or they had to shut down. And, fortunately, we did not have to close our doors, and we were able to continue to serve the community. But in a lot of communities, they had to do that. And a lot of the support groups had to stop meeting. And, there was a point in time where they couldn't meet until they were able to go to telehealth and those types of things. So I think, that's has played a part over time. But addiction definitely puts a strain on connections, and connectedness is what saves lives. There's a lot of research out there that says the more connected individuals are to their family, their friends, and their community, the less likely it is that they're going to use substances, the less likely it is that they're going to want to hurt themselves if somebody's suicidal. And what we do know is that with addiction, what that does is that puts a strain on those connections. It forces somebody to choose between family, friends, and community over that drug or that high, and the connection is what suffers. So we do need to make sure that we provide that connection to individuals to know that treatment is available for mental illness, that treatment does work, that individuals can overcome addiction, and that to let folks know that what resources are available. So here at Bryan Medical Center, we do have the mental health emergency department that's available 24 hours a day, 7 days a week. We do here at the Bryan Independent Center, which is our substance use arm of the behavioral health services. We do have detox services available. So if an individual does need to detox before they get into services, they can come into the emergency room and get checked out and so forth, and then get admitted into detox services. But then we do have residential services. We do have services for adults and for youth for our residential program that will assist individuals through their addiction. And then we also have partial care services, intensive outpatient services, and outpatient services. So we have a whole continuum of services for substance use. If folks are just not quite sure what to do or where to turn, they can go to our website and take a screening. There's several screenings on there that will help them determine if they have a substance use concern, if it warrants further evaluation. And they can call the Independence Center here at 402-481-5268 and schedule an outpatient substance use evaluation that will help give them some direction as far as what next steps to take to help them.
Great. Thank you, Dr. Myers. We appreciate that very much. Media, go ahead and we can open up to questions now. So if you have one, just go ahead, unmute yourself and then direct your question to Dr. Myers or Dr. Bonine, and they'll be happy to provide whatever they can.
This is Bailey with 1011. I have a question for Dr. Bonine. Can you just kind of describe how serious the patients you're seeing, what condition they're in when they come in?
Yeah, sure. I've seen a wide variety, but very serious, most people. The fentanyl that's laced in this cocaine that they've been taking, it decreases respiratory drive, decreases heart rate, basically decreases oxygen to brain, organ cells, and people come in essentially in a coma. A lot of the patients, fortunately, the first responders have seen and given Narcan before they've gotten in there. That is helped, assuming it's been administered in a timely fashion. On the end of that, I've had people that have been, in a coma or unconscious long enough that the Narcan's not helping. And those people end up requiring intubation, which is a tube placed down the airway, mechanical ventilation, and life support. So yeah, it's the stuff that's out there right now is real bad, and it's making people really sick.
Is this something that if treated, people can, just get up and walk away from? Or do you see people who have lifelong effects from an overdose if they are treated and do survive?
That's also, there's a wide variety. If someone is overdosed and receive the antidote in a timely fashion, at times they get discharged from the ER after observation period. But I know in the last few weeks, there's been a few deaths in very sad cases. So it really just depends on how long that they've been unconscious, and the damage that has occurred due to the loss of oxygen.
This is Joseph.
Go ahead.
With Channel 8. I'm wondering, this is for Dr. Bonine. So when a patient arrives at the hospital with an overdose, can you walk through like where specifically they go? Do they interact with mental health at some point? What's kind of the process of like how that patient is taken into the hospital?
Sure. Well, initially they come in either by EMS or private vehicle. And then, we do our best to medically stabilize them. So, if they're unconscious, the team tries to figure out what caused them to be unconscious, administer the antidote and supportive care. If they're able to wake up and after an observation period, I deem them medically stable, I'll refer them to talk to the mental health folks. That way they can seek treatment, do our best to do some counseling in that regard. There are a lot of resources available in the community, so we try to point them in that direction. In turn, if they're more sick, they get admitted to the hospital, some to the ICU, and they're essentially in a coma after that. So it just kind of depends on how severe their case is. We try to direct the disposition based on that.
So if they are admitted to the hospital, it's okay if I'll add to that. If they are admitted to like the ICU and they are in the inpatient unit for a while, the physician who takes over care on the unit can then order what we call an intervention nurse consult. And that's a service that we have through the Independence Center. And so if that individual is on the unit for a drug overdose, or maybe they're in a car accident and they were using drinking alcohol, whatever the case may be, they can write an order for intervention nurse consult. We have nurses that are specially trained in substance use evaluations that would go over, and they would interview and evaluate that individual and then make recommendations for services to them.
I have a question. Either one of you can answer this. Just given the information that we have and the cases you've seen recently, just what would you want the community to know about how dangerous and scary of a situation we're having in the community right now?
Well, I guess I would say if you know people that use illicit drugs, I think educating that the stuff out there right now is really, really nasty. And, obviously the cliche is don't do drugs, but people do. And people need to educate their friends and family that there's very, very life-threatening drugs out there that are causing a lot of problems. One thing I'd like to add that people, or I don't know if a lot of people know, you can actually get Narcan at pharmacies. And I encourage anybody that's using drugs to get some, because the people that are surviving this, it's because they received Narcan at a timely fashion, and it really does save lives. Fortunately, most of the people that I see come by ambulance, and the medics have already administered that in a timely fashion, and they're able to wake up and talk, and obviously avoid long-term problems. So, but educate, try to discourage the use, let people know there's resources out there to stop, and people need to try to know what they're putting in their bodies as well. So.
Yeah, and it can be, it's a struggle, and individuals, maybe have tried before to stop and have tried several times to stop. And as Dr. Bonine said, that, there's just some really bad stuff out there. And, this is a good wake up call that, even if you've tried before, now is the time to try again, and to use the resources that are out there to, and use your support system to make every effort that you can to get back to a healthy life and to stop using.
I have a question for maybe Dr. Myers, but if Dr. Bonine can weigh in. I'm just wondering, as mentioned in an earlier press conference, no one intends to be an addict, right? People, how do you open up that dialogue, when people may be embarrassed to talk about it? Maybe it's a pride issue. Maybe they want to protect that addiction. How do you open up a conversation with someone to advocate for them to get help when it's something that's so tough, so complicated? What do you advise? What have you seen that's kind of worked in getting through to people about this?
What I've seen that works a lot is individuals' testimonials. So if you, you know, just listening to the person and, you know, letting them know that you're recognizing the signs and symptoms that that you're seeing them struggle, and then just listening, you know, being a good listener. But that if you have you know, some stories or a testimonial of somebody who has overcome addiction and can share that, you know, a lot of times it is that confrontation and sharing that information with somebody, so that they can see that, you know, that this can happen, that this can be overcome. A lot of times folks think that, you know, it's something that it can't be. It's just so it's an obstacle that it's just too steep, and it's not, and it can be overcome. And you know, getting them connected to the resources is the main thing, and you know, getting them ready to be willing to go in and just talk to somebody with you, oftentimes is that first step.
And I have a question for Dr. Myers. Just you kind of talked about how the pandemic has affected this, but obviously we kind of saw the pandemic subside and kind of in the early months of this year, in the middle months. What do you make of it that it's, even though the pandemic is kind of what maybe started this uptick in overdoses, even as it subsides, that the problem is actually still getting worse here locally?
Yeah, well, what we're still seeing though is that a lot of the support services that are that during the pandemic still have not been able to resume kind of the in-person meetings and those types of things. So a lot of the things are there for folks, but they're through telehealth, and that, you know, that's effective and that can be helpful. But what we find is that person to person is the most effective. You know, when we talk about connectedness, it's that face to face, meeting to meeting is the most effective. And that's what we're seeing. You know, we're still providing our services here, but we're still limited in some of the things that we're able to do with even some of our like with some of our alumni and some of those types of things that we're still under some of the, you know, different regulations and different things that we're not able to provide because of the pandemic. And so I think the restrictions still have placed some limitations on some of the things that agencies are able to continue to provide. The other piece too is that you know, I think just overall, just in the healthcare industry, I think it's important for you know, for you know, just for health equity and for you know, not every individual has access to be able to you know, to reach out and you know, depending on their insurance, to be able to access you know, drug and alcohol or mental health services.
Dr. Myers, what would you say to someone who needs help but is apprehensive about getting it because the costs might be prohibitive to them? How do you address, you know, those types of gaps, especially as you mentioned earlier, like, you know, financial aspect is something that can drive some of this addiction?
To not let that be a barrier, that services are here regardless of an individual's you know, ability to pay, that we will help individuals and we'll get them connected to services that will help them. Lincoln is very fortunate to have a wide variety of services to treat mental health and substance use here in our community. And there are services that will treat individuals that have no insurance or do have insurance. And all of our agencies work very closely together. and we make referrals back and forth, and we will get folks connected to the services that will help them.